So we don't have recovery stats for France or Spain or Iran. Well, Iran, we have recovery. Italy, we have recovery, but then we don't have any for Spain or France. I'm just kind of looking at that.
Yeah, there is on another site, World Meters, that we could put up as well.
I'm just curious.
Yeah, currently.
And I don't know the current specific stats for Deschutes County. I don't have that stuff in my head. I mean, my job is really to look at stuff conceptually. So just to give you a heads up.
Yeah. I more just want to get people to take this seriously and
Cool.
practice social distancing. That's the point.
Okay.
That's for me.
Yeah, and Governor Brown had, where's that document right now? I'm going to go back to that from this call we did today at noon. There's some really important messages that I think are perfect for right now. They're timely, they're on point. So people need to keep focusing on.
So I heard sidelines was packed yesterday.
Last chance.
Are we good? Yeah. Yeah. Okay, cool. So, hi again.
Hi again. I'm a little further away from you than I was last time.
You are a little further away.
I am. We're practicing social distancing. Thank you very much. And we've got our Clorox disinfectant because we know the Clorox wipes kill the virus.
Yeah, and we're in an office that normally has 21, and now it's us three. Mitch controlling stuff, and Mitch is also like 6 feet away.
Yeah. Way much further than arm's length.
Yeah. So, what's it like these days right now being mayor?
I always focus in on my job and what my role is as mayor. I mean, people look to me for guidance, for reassurance, and for direction, and to work with my other 6 colleagues on Bend City Council to make really solid policy decisions to make sure our community stays safe, can take care of itself, and make decisions that look forward by how we move through this event, this pandemic, this really unprecedented event in the world, in our country, in our state, in our community, and how we plan for how we get out of that. I'm having those conversations as well right now. We all are.
And what is Ben's local state of emergency currently as a result of COVID-19?
So the city manager has declared a state of emergency in the face of COVID-19. And it allows us as a city to really adapt in real time our codes, our policies, our protocols, whatever we need to do to keep our community as safe as possible. That's what a state of emergency does. The council has to ratify it, so we'll have a very short meeting. Excuse me.
No worries.
Lots of talking these days.
I'm sure you are.
So we'll have a very short council meeting on this Wednesday, and then
on Wednesday?
On this Wednesday night.
Okay. And is there ways that is that going to be live streamed?
We are always live streamed. Okay. Our work sessions and our council meetings are always live streamed. But people are going to have to get on right at 7 p.m. because this is going to be a very short meeting.
Okay. 7 p.m. Wednesday to ratify the state of emergency. How do you think Bend, I think a goal that is something that could be obtainable here, but how do you think Bend could have the least amount of cases per capita in the U.S. of coronavirus?
We need to be proactive and defensive about this. We recognize that throughout the state. I want to recognize Governor Brown for the really tough decisions she's making and she'll continue to make for our entire state. And Bend, certainly we need to follow those. And the way to make sure that we have the police, the fire, the nurses, the doctors, everyone we need to take care of us is to practice social distancing. We need to clean surfaces. We need to not go out and meet with our best friends in crowded public spaces. We need to keep our social circles really small. Because there is no vaccine for this. There is no way to prevent this. The only way to prevent anyone from getting infected is to not get infected ourselves.
And so this is where we
turn your mic up a little.
My mics
on the top knob.
So what?
The top knob above that one, and just crank it up a little.
Better. Better,
Someone
better,
was
better.
saying it was a little low.
Better, better, better. Okay. All right. So, okay, we were just talking about social distancing. All right, I want to talk more about that. The community, there is people that are taking it seriously.
Mm-hmm.
There are people, though, that are also not. There are people that are thinking that this is just another flu type of a thing, and that it's maybe that there's no way that what happened in Italy can happen here. What is your stance on like or what would you say to those people that aren't taking it?
It's a communicable disease.
Okay.
You may be 24, you may be young. This may still really hit you hard. But what you want to make sure is that you still have you still want to have who can keep you safe. You still want to have, the nurses and the doctors in our health system who can take care of you if you have a father or a grandfather or a grandmother or someone in your family who may be slightly maybe experiencing immune deficiency. You want them to be safe too. You need to keep yourself safe because again, there's no other way to keep them from being affected. So it's about taking care of our broader community and our whole family, and it has direct impacts on you and your life.
Yeah, and there's a few numbers that I don't think a lot of people my age understand too, because my generation, I'm 30, or I'm 30, I'm in my 30s, I'm 32, and then people in their 20s.
You're young.
Yeah, exactly.
Yeah.
So there's this, oh, it won't affect me,
Mm-hmm.
I'll be okay. But right now in Spain, there is, let's see here. No, in France, the France top health ministry said on Monday that things are deteriorating very quickly, and about 300 to 400 people infected with the virus in the country are in critical condition. He said about half of those patients are under the age of 65 years old. And that the thing is that although we are less likely to go into critical care, we are, our generation of 20s and 30s, it's a 0.2% mortality rate for us, which is much less. However, that is 20 times more than the flu, because the flu is 0.01%.
Yeah.
So I think that's a number that people should understand. You're 20 times more likely to die as a 20 and 30-year-old from this. And your grandparents and your parents way more.
Yeah, but think of it this way. Like if you go to the mountain and break your leg, you want to be able to get into the emergency room. You want somebody to be able to set it. And if you're in a car accident, you want the EMTs and the police to get there, take care of you, transport you to the hospital where you can get taken care of. I mean, right? A lot of different needs happen to take care of you. And everybody has to understand that the ramifications of them not being responsible in this moment in time. And again, shopping in this store, this is the opportunity to knock on their door, and just say, hey, what can I pick up for you? Do you need a loaf of bread? Do you need a whole bunch of soup? What do you need?
So what you're saying with the hospitals and like me breaking my leg in a car accident and wanting to be taken care of, which can easily happen, just snowed and bend. It's very slick out there.
Yeah.
So, I mean, right now it's okay. We have 4 or 5, is it 4 confirmed cases in Deschutes County?
Yeah, those stats keep changing.
St. Charles. And currently a typical 19, that's 900 people going off of 9,000.
Yeah.
And right now, the global stats rate, Mitch, if you could show the ourworldandData.org link towards the bottom, that one basically shows a 15% rate of people that get it need to go into ICU, critical care. So that number ends up being 135 people. Well, we have 250 beds and 70 to 90% of them being used. So to your point, if this does the normal thing that it's doing across the world, our hospitals will be flooded. But if we practice social distancing, then we give our hospitals an actual shot.
Right.
And that's the scary thing when people aren't taken seriously. I'm like, we're not going to give our hospitals a shot. We're going to be overrun. So is there a concentrated and coordinated effort at the local, county, and state levels?
Are you asking about quarantine? Is that what you said? I mean, well, so here's what I will say. I mean, gosh, time goes so quickly. I can't remember exactly when we put together our Joint Information Center with St. Charles, with public safety, so Bend, the fire departments. Remember, the Bend Fire Department is your ambulance.
Right.
We provide those ambulance
Mm-hmm.
services with the schools and a lot of other public agencies and service providers. So we have a Joint Information Center. We're connected with the state as well as like monitoring what's going on the national level.
Mm-hmm.
These are the people that are making these decisions and implementing them right here in our community to keep us safe. Remember, we're trying to keep every single community member safer than you would be otherwise. So in terms of quarantining, have they been in quarantines and things like, have they been looking at different ways to worry challenges? Just stay at home, you know, get your family or, you know, take care of yourself there, but don't just show up anywhere. Please don't just show up anywhere if you're feeling right.
Absolutely. So how can,
Sorry, I'm gonna revert back to just Facebook because the quality is not coming through.
okay.
Serious, you know, as you always would if you are in a serious place.
Mm-hmm.
If you felt you had some serious medical issues that you were scared of and needed to be in a very addressed in a exceedingly timely, pace.
How have you been being like forced in the interactions and stuff? So it's been a bit stressful.
I keep washing my hands.
Mm-hmm.
Okay, it's coming through a lot better.
Okay. So people need to call, if you're feeling ill, call your doctor, primary care. And you were also saying,
yeah, don't show up at the hospital unannounced. And all this protocol is, so there, I mean, one of those, so I'm gonna pivot. The most important things in this conversation to get out to people is there are a lot of rumors and a lot of sort of slightly incorrect or completely incorrect information going around right now.
yeah.
And so it's really important that all of us go to really strong, how do I say this? Information sites that are grounded and have consistent, informed information. So, for instance, the Bend Bulletin is doing a great job, but the source of it all is really out at theshoots.org, COVID-19. They actually, and I went out and went through it this morning, actually, in preparing for this.
Right.
And they have, how would it feel to have COVID-19? What should you do? When should you call your doctor? When should you call the emergency room and say, I'm coming? When should you call 911? Right? I mean, has all those questions, has all those answers. How should you interact in the community? I anticipate, just as the president so nationally just reduced the gathering size to 25, to probably keep it at 3, but right.
Yeah,
So and outside, right? Tried and So anyway, all that protocol is out at Deschutes.org, Deschutes.org, COVID-19. And I think we just have to keep going back to the basic information and not always listen to, the story that your neighbor is telling. That's important for the health of our entire community. Get really solid, information from a reputable source.
Do we have more tests coming to become more easily available on the horizon for Bend?
My understanding is that all is being addressed in real time. Part of it is allowing different types of testing. Part of it is allowing more local labs to be able to do the testing. My understanding is all that shift is happening right now as you and I are sitting here talking.
Okay.
So I'm not in the heart of every single discussion, but I know I've heard that in so many, so I know that's happening right now.
Yeah, it's a concern for, as a country, we're testing so little. Oregon was for the past week only doing like 80 tests a day. So it sounds like we're getting more, but unfortunately, like with even my own experiences here of having a team member who was near somebody that was in contact with a COVID-19 person, confirmed case in San Francisco, she wasn't able to get tested because just of the supply. And so it's if you have symptoms.
Yeah, and here's what I'm going to say to that is that we know that people are communicable even before they have symptoms, and we know that we're going to have limited testing. Say let's just assume that. So the best thing for people to do, again, especially knowing that you're going to be communicable even before you have real symptoms, is just to practice social distancing. That's the way we're going to keep well. The testing, testing, right, until you get to a certain level that you're not going to show a positive. And so I don't think we as a society, or you and I sitting here at this table, we can't fully depend on testing at any given time. Obviously, those people who are experiencing respiratory distress and who have a fever, that's really clear. And right now, we have the test to confirm it's that and not some other type of influenza. The other thing, of course, that complicates this is that we know there's a lot of influenza A and B around our community right now. So, A and influenza B. We know that's still going around. So we've got a couple different viruses traveling through our community, but we just need to be more diligent than ever to pull back and not risk infecting each other.
Yeah, and I think that some people might think that there's only 4 confirmed cases and that, oh, well, then the odds are really low. But it's pretty much mathematically impossible, especially the 4th case got it from the community on Sunday, was reported from KTVZ that the community gave it to them. So it's out. I'm sorry, everyone, but it's out there. And if you're not practicing social distancing, if you're getting upset saying you're going to sue Mount Bachelor because they're closing, when that is the right call. And that was a hard call for Mount Bachelor to make, but the Italian house closed down. I practiced social distancing skiing when I was there because I went to Northwest and I was taking one lift at a time. But Pine had 4 people on it most of the time, shoulder to shoulder to shoulder. And the lodge, which I didn't go into, I was eating a Cliff Bar. I brought like 3 Cliff Bars. There was no way I was going in.
Good, thank you for that.
Yeah, but it was stacked. There were so skis for days of people that were in there at lunch, and I was just looking at it going, oh my God.
Yeah.
And so social distancing, if Mitch, can you scroll down to show the graph? So this is Italy. And here is basically, they were not. And so here we have exponential growth going up of total cases, and it's still going. So they added yesterday 3,000. Mitch, can you scroll up to see the new? No, that's scroll down again. They added somewhere around 3,000 new cases, 3,500, I believe, yesterday, and 300 some odd new deaths. And they didn't take it seriously in the beginning, and they've actually put out, we put a video in the hyperlink of this of like a bunch of Italians telling us Americans and people in the UK that they're watching us not take it seriously, and they did the same thing, and it's just a video of one Italian after another saying, please don't do this, please don't do this, please practice social distancing. It's okay, learn how to play guitar, learn like all this stuff. It just goes on and on and on. It's very powerful, but this ends up happening with something that I've been learning that human minds have a hard time comprehending is exponential growth. And so too. And by the end of a year, so in 12 months, the pond will be covered in lily pads. So if I were to say, how long would it take for the pond to be half covered in lily pads? You would think, most people would say, well, it'd be 6 months. Actually, the answer is actually 11 months. So in 11 months, half of the pond is covered, and then
really, especially certainly for Bend and for Oregon, is how do we begin to flatten that curve? And what do we have? And what do we do to flatten that curve? And I think that's what all of us are working so actively on right now. And, you know, one of the things that Governor Brown said this morning, which I think is, you know, there's no vaccine, there's no medicine. You know, the only solution we have right now is to slow down the transmission. And the other message that she had was, so yeah, you young and healthy people, you can be contagious and even not symptomatic, but it's imperative that everyone follow these guidelines because it's a matter of life and death for some of us. And who would want to carry that burden? No one. No
Yeah.
one, right?
And
And
just
so I added
so-
that on to the end, but right, I mean, that's my question, right? It's like none of us, right? You know, we want to take care of ours. And so, you know, certainly as mayor, you know, that's my job. And I take that so seriously, right? We need to take care of each other. And this is the only way we can do it right now.
to basically stay away from each other. And so it's just, I feel like I'm beating a dead horse, but if we keep on going out and thinking that this doesn't apply to us,
Yeah.
then we're going to be sorry, like Italy sorry.
Yeah. And
Like these are like, that would be like generals getting shot in an army. And we're saying, oh yeah, well that's okay. We'll just put in new ones. But where, from where?
yeah, no. Yeah.
So what, have we been getting resources to Deschutes and Bend from the federal and state communities?
You know, I want to do a shout out really, especially to Sherry Helt. I know our other state representatives have been, you know, and electeds have been yesterday. And she's working with our staff, you know, our health, with our leadership at the city, with our economic development department, trying to really find solutions that work for our community, that keep our community healthy, but also we provide so many services in so many different forms to the community as a whole. And so do all sorts of, but essentially